Even a second of pain while chewing is too much. This could be a sign that you have a cracked tooth. There are several things that can lead to a cracked tooth. Chewing on hard objects or foods like ice, popcorn kernels, or hard candy. An accident like a blow to the mouth. Grinding and clenching your teeth. Uneven chewing pressure. Loss of your tooth structure from natural wear and tear, large fillings, or other restorations. Or exposure of tooth enamel to hot and cold temperature extremes. A crack in a tooth is typically a hairline fracture that runs vertically along the tooth that's often invisible to the eye. It may be so small that it doesn't even show up on an x-ray. You can help your dentist determine which tooth is causing you pain by paying close attention to your eating habits. When you eat, do you feel a sharp pain that lasts only a second? Do you avoid eating certain foods like apples, popcorn, or nuts? Do you tend to chew only on one side of your mouth? Write down this information and be sure to note where you think the pain is located and if the pain is from hot, cold, sour, or sticky foods and liquids. A cracked tooth may hurt because the pressure of biting causes the crack to open. A sharp pain typically results either when you bite down or when you stop biting. When the crack opens, this pulp becomes exposed, irritated, and extra sensitive to hot and cold temperatures. Pulp is the soft tissue inside your tooth that contains all the tooth's nerve and blood vessels. Treatment for a cracked tooth varies depending on the size and location of the crack. Treatments range from repairing the tooth with a filling material, getting a crown to hold the crack together and strengthen the tooth, having a root canal treatment if the pulp is affected, or in severe cases where a tooth cannot be saved, it must be pulled. Your dentist will determine the best treatment for you. If the crack causes no problems, your dentist may recommend no treatment at all. Remember, there are things you can do to help avoid a cracked tooth. Don't chew on the ends of pens or pencils and never open a bottle with your teeth. When eating, avoid biting hard foods like nuts, popcorn kernels, hard candy, or ice. By adding a few simple precautions into your daily routine, you may help prevent a cracked tooth. If you have any pain while eating or drinking, avoid chewing on that side of your mouth and schedule an appointment with your dentist. Don't wait until it's too painful or too late. With the proper care and precautions, your meal times can once again be pain-free. If you have an injured or diseased tooth, there's good news. Your tooth can often be saved with root canal treatment. There's a lot more to a tooth than just what you can see. That's the outer layer of enamel supported by hard tissue known as dentin. A canal running through the dentin contains all the tooth's blood vessels and nerves. This is known as dental pulp. The pulp goes all the way down to the tip of the root, which is located in the jawbone. Root canal, also known as endodontic treatment, is a procedure that removes injured or infected dental pulp. The most common causes of disease or injury to the pulp are a cracked tooth, a deep cavity, complications from large fillings, or serious injuries to the tooth. If the infected pulp is not removed, the tissue surrounding the root of the tooth can become infected, resulting in pain and swelling. Even if there's no pain, substances released by bacteria can damage the bone that anchors the tooth in your jaw. Without treatment, the tooth may have to be pulled. Root canal treatment often involves a couple of dental visits. Your dentist or endodontist must perform several steps of treatment in order to save your tooth. First, an opening is created through the crown of the tooth and down into the pulp chamber. Then the pulp is carefully and completely removed from both the pulp chamber and the root canal or canals. Each root canal is then carefully cleaned and shaped, and medication may be added to get rid of bacteria. Next, to prevent saliva from getting in, a temporary filling is placed in the crown opening. Antibiotics may be prescribed if your dentist or endodontist notices an infection has spread beyond the end of the root. At the next visit, the temporary filling is removed. The root canal is then filled and sealed. After your root canal is complete, you must return to your dentist to have your tooth restored with a filling or a crown. Crowns are used most often because they strengthen your teeth and improve their appearance. Root canal treatment can last for years, but only if you continue good daily cleaning habits. By following a good oral health care routine, you can help keep all your teeth healthy and strong, whether they have had root canals or not.